Thank you for joining us for this segment of the Mental Health Series presented by Intellios, which includes the American Registry for Diagnostic Medical Sonography, ARDMS, the Alliance for Physician Certification and Advancement, APCA, and the Point of Care Ultrasound Certification Academy, in partnership with the American Psychological Association. Your mental health is just as important as your physical health, and even more so when you are in the middle of a crisis, dealing with new challenges and uncertainty. The well-being of our healthcare professionals is critically important to us, which is why we created this mental health series. We want to help take care of you so that you can take care of your patients, your friends, and loved ones.
Hello, and welcome to today's webinar. I'm your host and moderator, Dale Sear, CEO of Intellios. Intellios is proud to partner with the American Psychological Association to bring you a three-part webinar series focused on important and timely mental health topics. Today's webinar is the first of the series. We also hold a live webinar on November 18th addressing stress, fear, and burnout. And then finally, we will host a webinar in early December on resilience. Stay tuned for more details about these upcoming webinars. Now, before we get to today's panel discussion, there are a few things we need to cover. Today's webinar is scheduled to last 1 hour, including some time for live Q&A at the end. This webinar is approved for one free AMA PRA Category 1 CME credit, and to claim your credit, we will provide a survey link at the end of the webinar. Viewers can submit questions for the panelists through the chat box on YouTube. Staff members will be monitoring the chat. The webinar is being recorded and will be posted on the RDMS, APCA, and POCUS websites for on-demand viewing after the event. Additional mental health resources will also be available on our websites. And on the screen, you'll be seeing the objectives, the learning objectives for today's webinar. This webinar is for informational purposes only and is not intended to provide medical advice or be a substitute for professional medical advice, diagnosis, or treatment. Now, I'm very pleased to introduce our panelists today for this important conversation on leadership and self-care. Dr. Arthur Evans, Leah Jolly, and Dr. Raymond Russell. Dr. Arthur Evans is CEO of the American Psychological Association, the leading scientific and professional organization representing psychology in the United States. With nearly 121,000 researchers, educators, clinicians, consultants, and students as members, APA promotes and disseminates psychological knowledge to benefit society and improve lives, a mission consistent with Dr. Evans's life work. He previously served in public policy positions in Philadelphia and Connecticut, and has held faculty appointments at Yale University and the University of Pennsylvania School of Medicine. Leah Jolly has a passion for teaching and is currently an assistant professor in the vascular technology program at the Oregon Institute of Technology. Prior to beginning her teaching career, Leah worked as a vascular technologist and lead sonographer for Mint Medical and Kaiser Permanente in the San Francisco Bay Area. Leah has volunteered with the RDMS since 2009 and presently serves as the vice chair of the RDMS Council. Dr. Raymond Russell is a professor of medicine at the Warren Albert Medical School of Brown University. He is also director of nuclear cardiology, director of cardio-oncology, and program director of the cardiology fellowships. Raymond is past president of the American Society of Nuclear Cardiology and is the current vice chair of the APCA Council. So thank you, Arthur, Leah, and Raymond for joining us today. We're excited to have you. And are you ready? We're ready.
Absolutely.
So I'm going to start out with an initial question that for Leah and for Raymond, and we can start the conversation from there. So Leah and Raymond, as clinicians, you and your colleagues over the last 7 to 8 months have had to practice and live your lives in a very unique and stressful environment because of the COVID pandemic. So what are you seeing in the field, and what kind of stresses and concerns are you and your colleagues dealing with right now? And we'll start with Leah.
Thank you, Dale. What we're seeing is early on, lack of PPE was a major stressor all across healthcare, but particularly in the field of sonography and medical imaging. We didn't have the PPE we needed to see our patients. In some places, we didn't even have the training to know which PPE to put on at which time. So that seems to have improved, but it's transitioned into more of, how do I get to see my friends and family? What can I do if I'm exposed? How do I handle that with my family? And other things such as childcare difficulties and difficulty obtaining employment. We've had a lot of people that were furloughed early on during the pandemic, and now they're either trying to get back to their normal work schedules and it's not happening, or there are hiring freezes at some institutions and can't obtain full-time employment. So it's been a real struggle in that way.
Mm. Raymond, what's your experiences?
Yeah, I certainly can echo a lot of what Leah said, that we've had to deal with a lot of unknowns. And I think a lot of conflicting emotions about how we're supposed to respond. Early on, when there wasn't a lot of data and guidance as far as how we should be protecting our patients, protecting ourselves, I think it was a challenge. And this was also compounded by, I think, the fact that as healthcare providers, we feel a huge commitment to our patients. And so if we were told we need to mitigate the risk of transmission of infection, that we should only come in when absolutely necessary, I think it made people feel guilty about that. Yet at the same time, you felt guilty about the fact that if you did go in, you were putting your family at risk and your friends at risk. And so you had these counterbalancing forces that were pulling on you, making it very stressful. In addition, early on, I think we were all just kind of in crisis mode, which you can do for a little while. And, I think there was a bit of disbelief. And yet now we're kind of going into the chronic phase and learning that this is a marathon, it's not a sprint, and having to kind of recalibrate how we deal with this. So it's been, I think, a bit of a roller coaster as we've gone through this. And, certainly we're not at the end of this. And I think that these 3 sessions are going to be very helpful for people to kind of figure out how to deal with this.
Excellent. So Arthur, at least what I've heard from Leah and Raymond are a couple areas of guilt and having no control of some of the circumstances. So how do people begin to deal with this?
Yeah, well, first of all, thank you for inviting me, and I'm glad that we have this partnership with you all. The American Psychological Association is very committed to really trying to help educate people about the things that we can do to help manage our stress and distress that is caused by some of the events, the pandemic, and some of the resulting issues. One thing that I'd like to point out, though, is that this stress that people are experiencing is really widespread. We do a survey each year called the Stress in America Survey, and we've been doing this since 2007. And what we found this year is that 80% of the population, almost 80% of Americans, are saying that they are stressed, significantly stressed by the pandemic. And furthermore, about 70% of the population is saying that their stress levels have increased over the course of the pandemic. And we know that for frontline workers, particularly healthcare workers, that they are experiencing even more stress than the rest of the population. So this is a significant issue that we have to deal with as a nation. And there are a lot of things that are contributing to that. Some of that has to do with the level of uncertainty that people are feeling. One of the unique characteristics of the pandemic, unlike 9/11 or hurricane or other disasters that we face, this is an invisible threat to us, which makes it a little more insidious and more uncertain in terms of how is this going to play out in our lives. And we know from a psychological standpoint, whenever we are faced with a lot of uncertainty, that creates stress. Then you add to that any number of other challenges, like not having basic needs met in terms of protecting one's safety, having the equipment that they need, creates additional stress. In addition to that, maybe not so much for this this audience, but for many people, they're experiencing economic stressors on top of that. And then many people are experiencing not only the stresses that are related to work, but then they are parents, they are caregivers often of their parents, and all of those things are contributing to a high degree of stress. And in fact, our surveys show that if you are a parent of young children, your stress level is significantly higher than adults who don't have children. So a lot of things are contributing to this, and it's really the reason why I think this kind of session is so important. One, to identify what some of those stresses are, but then for us to develop strategies or to talk about strategies for people to reduce that.
Excellent, excellent. So picking up on that, back to Leah and Raymond, given the stresses, and Arthur just said how much more stress, especially families with little ones, can occur. So, being effective leaders and progressive clinicians as you are, and the colleagues that you work with, how do you handle the longer hours of work? And how do you have enough energy for yourself and left over for your families to maintain that type of relationships?
I think one of the keys for me has been to make sure I set aside time for work and time for family. That way I can try and minimize the overlap. I am one of those people that has young children. My youngest just turned 5, so he still needs a lot of attention. And if I'm, on my phone checking emails and things, when he's telling me, "Mommy, I'm hungry," or "Mommy, I need your attention," for some reason, I'm missing out on connecting with him during that time when I'm worried about something that I really could probably deal with tomorrow. So for me, that's been the schedule, and making sure I have specific times where I'm handling everything in my life that needs to be taken care of.
I have to agree. I think that trying to really place boundaries between your professional activities and your life outside of what we do are important. They always have been important, but I think particularly now with the added stress, you need to make sure that they don't really kind of seep into your personal life. And so, I've certainly tried to make a better effort at doing that. I think another thing that helps is to really try to separate everything COVID as much as possible from your life outside of work. And so, early on, I check every day, what are the numbers of cases, in my area? And I've stopped doing that. I've listened to audiobooks rather than NPR in my drive into work, just because I think it just adds to that burnout. And then one other thing that Leah mentioned is children and your other family members. It's not only the little kids. Our 20-year-old daughter has come back home to stay with us. And certainly we see the stress that she's been under, not only because of her job, but then also, she's a 20-year-old. She wants to go out and do things with her friends, and trying to figure out what that balance is to keep her safe, to keep us safe, to keep her friends safe is challenging. And there's no great roadmap to help with that.
Yeah, Arthur, coping mechanisms, it sounds. Raymond had a great example of doing audiobooks. Are there other ideas for coping mechanisms for healthcare professionals?
Sure, I thought those some great examples. One of the things that I think is really important is to recognize that, the people who are on this call, who are watching today, are people who are accustomed to dealing with stress. If you're working in healthcare, you're accustomed to that. But I think it's really important for people to recognize that this is different. What we are experiencing is like nothing that we've experienced before. And I think that there is a tendency to underestimate the level of stressors that people are experiencing, particularly for high functioning people. And so that's the first thing to kind of recognize, is that this is not normal, this is not typical. And in fact, I think it can be a little bit, we can underestimate because we don't have the physical cues in our environment that tell us that we're experiencing a traumatic situation. You know, when 9/11 happened, we could see, you know, something really bad happened. When there's a hurricane, we know that something bad has happened. I mean, we have ways of responding to that. But for most of us, our world looks pretty similar to the way it looked pre-COVID. But the stressors that we're experiencing are not. A couple of things that I would say is, number one is to I think, like Raymond suggested, recognize that we all need some time off. We need some space to be very intentional about separating home from family. I remember when I was on internship, my daughters were very young. They were like 3, 2 years old, and I can remember working these really long days and coming home and, you know, just tired, thinking about all the things that I had done during the day. And I would be very intentional about saying, okay, but I have to be daddy now. And I would sort of, you know, turn on my sort of my mental daddy hat, and then I would walk through the door, and I try to be completely present for them when I walk through the door. But that takes a lot of intentionality, and I think one of the things that we can do to help manage the stress is be very intentional about those kinds of strategies. I also think that Raymond's example of recognizing that media in particular can be very stressful, and continuing to watch media, checking on numbers and statistics and, you know, death rates and those kinds of things can be very stressful. And so taking a break from that is absolutely okay. And I'd also like to mention the election is also very stressful for people. Our survey is showing that across the political spectrum, whether you are Democrat, Republican, or independent, the levels of people experiencing or expressing that they're feeling stress from the election is pretty significant. Over 60% across the political spectrum are saying that the election season is also. So another thing that you can take, be very intentional about taking breaks from and reducing and doing things that are fun and pleasurable.
Excellent. Raymond, Leah, have any responses to Arthur's excellent outline?
I think that's really on point. I mean, taking time away from the stress and the negativity of the world right now is really important. I mean, it's hard. Life is hard enough when we're not dealing with a pandemic. And then you throw that major stressor on top of it that we really don't know when it's going to end. You know, I think personally, we found a lot of comfort in having our friends and family near. You know, we'll make an effort to have a barbecue outside where we can be apart or things like that, or talk to each other on the phone or whatever we need to do. But yeah, I think it's really important to take those mental breaks for yourself, even on a regular day, but right now in particular.
And can I add something to what Leah said? She mentioned getting connected with people. Actually, there's a lot of research that shows that our social support is a really strong predictor of how healthy we are, not only from a psychological standpoint, but from a physical standpoint. And when we're in a situation where we're being asked to physically distance, we have to be particularly careful that we don't hear that as being disconnected from each other. In fact, I wish we hadn't used the term social distancing because I think it sends the wrong message. What we're trying to do is physically distance, but we need to stay socially connected. And there are different ways. I like Leah's suggestion about, you know, you can maybe see each other physically, but be safe in doing that. And certainly there are a lot of virtual strategies that people are doing to do that. But connecting to our social network is a very important source of stress. And I would also say connecting to, if you are a person of faith, connecting to your faith community is also very important, especially now for a couple of reasons. One is it's an important social network, but also people of faith are also getting messages about how to understand what's happening and using a frame that makes sense to them. And so a lot of congregations are not meeting, but most of them, many of them have other ways of connecting. And I would encourage for people for whom that is a source of strength to make an effort to make those connections, because that's another way of providing comfort and some support.
And I have to say that, we talk about these new terms that we're dealing with like social distancing, and I agree with Arthur that it's almost an oxymoron, that you're really talking about two different things that you're trying to achieve. One that I particularly dislike is a new normal. There's nothing normal about this.
Exactly.
And so the things that we derive pleasure from, we need to pay even more attention to. And we have to recognize that right now, we may not be able to enjoy those things in the way we used to. If you like to travel, well, now you're probably not going to do it by plane. You're not going to go internationally. You're probably going to stay inside the state. But it allows you to see some stuff that maybe you've never even seen before. And you just need to change some of those patterns and take the good points away from it, and really take advantage of the different ways that you can connect with your social support network. We're now doing a lot of FaceTime, and it really is, I think, refreshing to see friends who might just call out of the blue, who'd never, we wouldn't talk to them for months. And now, you see them every couple of weeks through FaceTime. So you have to hold on to those things and cherish those opportunities, but recognize that it's something that now is the way to stay connected.
Yeah, very good. Well, picking up on that, on all three of your excellent comments, this kind of picks up on the chronic stress that certainly the heightened stress that's been occurring, particularly for healthcare professionals, frontline workers during the COVID crisis. And, because of this, some healthcare professionals in this crisis, they're having difficulty engaging with their jobs and have lost passion for what they used to enjoy. Are you seeing this among your staffs and colleagues at your work settings?
Yes, in some cases that is happening. And I think a lot of it has to do with communication, especially from the leadership of the organizations and even, just your managers that are right over you. People really want to be appreciated. And especially in this time where we're facing something that's very scary and on the front lines of it, where we might be seeing patients that have this every day. Just a pat on the back is sometimes something that is all we need to keep going. It doesn't take much for that. There are other things that would be nice, extra vacation, hazard pay has been mentioned by a few people, and things of that nature, but just something to recognize that, hey, we realize that you are working hard and we appreciate what you're doing.
And I think it's also important to acknowledge that that people are going to have days that they feel frustrated, that they feel angry, that that we're in now a second wave, and so it's important to on all sides cut everybody slack. When we first started dealing with this, I had meetings every week with our fellows, our trainees, and I would bring them up to speed. And as I mentioned before, it was important to have the balance between not doing it too frequently and not doing it too infrequently, but then also acknowledging that we aren't going to do it perfectly. We don't expect other people to respond perfectly because we're just humans, and so we need to give each other that space and help people when they do get frustrated, when they do get burned out, when they get tired. And so we absolutely need to keep those lines of communication open.
Excellent. And Arthur, do you have any other suggestions or advice for healthcare providers who are feeling less engaged and passionate about work or life?
Well, I think that can be a sign of stress. And one of the things that I think that all of us have to do, and especially now be more aware of, are what are the signs that we're experiencing stress? On our website, we put up information about here are signs of stress. It's a pretty long list of things. we manifest stress in different ways. And I know, for example, when I start forgetting things, that's a sign that I'm under stress. That's pretty usually a pretty good sign that something's going on with me. Or I start to get a little cynical. I am probably one of the most optimistic people you will ever meet in life. But when I get stressed, I start to get pretty cynical about things. And so when I hear that, that's a cue to me that I need to pay attention to what's going on. I think if people are feeling that way, I think you ought to, most people trained a lot of years to do what they do. So, you don't want to walk away from that unless you really need to or have to. So I think it's important to get help for it, to recognize that as a sign, to reach out for help, get professional help, see a psychologist or other mental health professional that can help you if you're experiencing that. But I also think that there are a lot of self-care things that people can do, and we've talked about some of them already. But to be very intentional about trying to manage the stress and distress that you're feeling. If that's not working, then get professional help to work through and talk through what you might be going through. And then you might decide that maybe this isn't what I want to do, but I'd hate for people to make that decision prematurely.
Very good. And Lee and Raymond, do you or any of your colleagues, are there specific taking care of yourself coping mechanisms you do during the day at work? Very stressful day at work, could be long, very long day, stressful, or anything during the day that you do to alleviate stress, or things that you see your colleagues do?
Well, I'd say, even just taking a deep breath, stepping away for a second can make a huge difference in a few short seconds. Also, I tend to stretch. So whether that's in between patients or when I'm teaching my students, particularly in sonography, because ergonomics is such a hot topic these days anyway, stretching just makes you feel good, and you're breathing and sort of being quiet, or you can chat, if you're doing it in the hallway together. But that's really worked well for me and some of my colleagues and students in the setting that we're working in right now.
Yeah, just stepping away from whatever it is that's raising your stress level, and that can just be doing some deep breathing, standing up, walking around the hallway, um, listening to a little bit of music if you have that opportunity. Just removing yourself from the situation for even just a few minutes, so that you can also recognize what's causing your level of stress to increase. I think so you can acknowledge it is very helpful.
Well, here's a question that's come from our participants today. It's a different type of stress than what we've been talking about, and it's really dealing with healthcare professionals who have been furloughed. And we all know that there are physicians, nurses, sonographers that have been furloughed out of healthcare systems. And what I'm reading within the question is that such a feeling of guilt that they cannot contribute to the care. Have you had experiences with your colleagues of being furloughed, and how are they dealing with that?
I think a lot of the places I've heard that have furloughed at first gave their employees an option. So particularly if you yourself were high risk or lived with someone who was high risk and wanted to take that option, they allowed that first. And then it was kind of, hey, we just need you to do this and kind of take one for the team. In some ways that was strange because it seemed like there were other ways they could have been used, in answering phone calls or triaging or, monitoring PPE use at the door or whatever it was. So it was a pretty interesting dynamic that came about with that. So in some ways it helped the safety of the employees, if you were high risk, and in other ways I think it was really hard for some people.
Yeah, I think that sense of guilt about not helping. We're used to, being they're at work, working, a schedule. And so when you lose that schedule, it really becomes very disorienting. You really kind of fall into a limbo. For our trainees, there was actually a requirement early on that we really minimize their exposure unless they were needed for, mission critical rotations. And so initially it was, they went home and did self-directed reading. But pretty quickly what we try to do is to get them involved again through kind of remote activities. So telehealth visits, reading echo studies remotely. And so that they were still contributing and learning. That really was a big positive thing that could be done. And so I agree with Leah. If there are areas that someone doesn't even necessarily do, monitoring PPE, screening patients as they come to clinic. If those things can be implemented, I think that's very important.
That's excellent. Here's another question that maybe Arthur can pick up on from our audience. Without question, people in our audience today have dealt with death, whether it be with patients, with colleagues, or even family members during this high times of stress. And that additional stress of that type of loss that's close to you, Arthur, what are there additional coping mechanisms with family and friends that one may have lost on top of all the COVID environment for healthcare providers?
Yeah, I think, for healthcare workers who are working and dealing with grief and loss, I think that's when I think it's really important to be able to talk about what one is experiencing, and whether that's with colleagues or with family members or with a professional. When you notice that those kinds of losses are starting to have an impact on you, I think it's really important to reach out, have an opportunity to talk about it. Talk about it with grief. People who are trained in grief counseling is another strategy that you can use if you find yourself in that situation.
Good advice. Thank you. So there's some concepts that came through the audience as well that I thought was very good. And Arthur, this would probably be more directed to you, but Leah and Raymond, please jump in. But there's the terms of self-care, self-love, and selfishness. And could you talk a little bit about those terms and how they relate to each other and how we should address them?
Well, it's a really great question, because I think, again, for healthcare workers and people working in healthcare, I think you tend to have a lot of people who are very selfless, people who, will go without eating because they have patients to take care of, people who will just make a lot of sacrifices. And that's important. So I think the whole idea of being selfless is probably a core part of being a healthcare professional. Self-love, which really has to do with how do we take care of ourselves. And I don't think the term, I certainly don't mean that in some kind of selfish way, but just having regard for oneself, taking care of oneself is also important. But I think it's critical to not see those as terms that are opposites of one another. Self-care and selflessness are not opposites. The opposite of selflessness is selfishness, right? And why that's important is that it's important to be both selfless, but also to engage in self-care activities and things that help us take care of ourselves. I like to use the example of, for those of us who fly, one of the first things you hear is that, if, there's a lack of oxygen in the plane and, the mask drops down, put on your mask first before you try to help your child or someone that you're flying with. Because if you don't take care of yourself, you're not in a position to take care of the person next to you. And I think it's hard for people who are generally very selfless to do that. But I think it's critical, especially now when people are experiencing more stress than they would typically experience. And so self-love, I think, is absolutely necessary to be the kind of selfless people that we want to be in our roles and in our jobs.
Very excellent. Very good. Leah, Raymond, do you have anything to add?
I agree completely that we need to be mindful of ourselves and our own care as we take care of other people, because if we either get sick and have to isolate, we won't be able to take care of them. If we are not able to really support ourselves from a mental health standpoint, we're not going to be able to support the people we're taking care of or our loved ones. And so it is very important to strike that balance.
Dale, can I add one thing to this too? Because I think that there's also another term that I think goes in this conversation, and that's the term guilt. And I think that a lot of people feel guilty if they are doing things that are related to their mental health or doing things that give them that break. And we really have to disabuse ourselves of that if we're going to be effective healthcare professionals. The reality is that it's important to take those breaks. Our mental health is not a luxury. Sometimes in our culture, we see that as sort of something that's extra or something that is a luxury. The reality is it's fundamental. It's as fundamental as taking care of ourselves physically. And so I think that having that orientation, that taking care of our physical health and our mental health are critical for our overall effectiveness in our roles as parents and our roles as caregivers, whatever those roles are. For those of us, those who are listening, who are in leadership, I think it's important for us to send that message. For example, in my organization, we and I understand that some organizations can't do this, but we did a mental health day, and when we did the mental health day, gave people the day off. This was after people were working 14, 15-hour days, literally for weeks at a time, and nobody was backing up, and we noticed people were starting to get a little crispy around the edges, and so we said, look, you got to take a day off, and there can be no emailing on these days and no phone calls or none of that stuff. And it was interesting. What our staff said to us afterwards was that what made that day work was the message from the leadership saying no emails. So we sent a strong message. So we didn't just say take the day off and don't do work. We said you cannot do these things. And that really freed people up to take that time that they needed. And so leaders really have a big role to play in this. And if you're in a leadership position, to not only send those, those global messages about take care of yourself, but be very specific about behaviors that you want people to not do that can get in the way of people doing that, or conversely, things that you specifically want people to do that will contribute to their health.
That's great advice, and let's pick up on that theme of leadership. And I've always felt that all healthcare professionals are leaders. They're leading. They're either leading their patients through whatever their services provide. They're also leading their colleagues around, their peers through these institutions. And given these emotional times, as a healthcare professional, that you may be a centerpiece of a lot of care and around your colleagues. How do you talk to your colleagues about stress and to lead them for betterment or to alleviate stress?
Yeah, well, a few things. One is it's important to understand how you are perceived as a leader within your organization, within your unit. What people, particularly people who have not been in leadership positions for a long time, may not recognize or realize is that people are looking at you. They are always looking at you, and they're taking cues from you, even when you're not intending to give off cues. And so, number one, to be aware of that. And when people are stressed, that they're looking at you even more intently and watching you. And so, how you model what the behaviors that you want people to engage in is really important. So you can't say, take time off, take care of yourselves if you're not doing that. What you do is going to be much more powerful than what you say. So that's number one. Number two, it's important to understand that the emotional state of the people that you're communicating with makes a difference in terms of their ability to hear, understand, and follow through on what you're asking. So if you have people who are extremely stressed, who are anxious, who are fearful, the way you communicate with them is going to be different than if you're dealing with a group of people who are angry and may have other kinds of feelings. We have actually on our website some tips for leaders in terms of crisis communication and risk communication. And we've been doing actually at the American Psychological Association work with mayors and CEOs around this, because not all of the interventions that we're talking about are things that we can do ourselves. Sometimes it takes leaders to set a tone and to make good organizational decisions that can help people in terms of the level of stress in their organizations. The last thing I would say is that, if you are in a leadership position, it's important to give those messages. It's important to model the way that we want people to behave. And it's also important for you to make sure that you're addressing the real needs that people are experiencing. So on the one hand, understanding that as a leader, there's both physical safety and there's psychological safety, and that we have to deal with both. We've been talking a lot about sort of how do you create a psychologically safe environment more, but there is a reality around the physical safety. And so we started this conversation talking about things like PPE and those kinds of things. If you're in a leader, you can't just ask people to do stress management and not deal with the realities of what people are dealing with. And so it really is dealing with both and understanding and signaling to people that you care about both. One other point that I think we found, and I found as CEO, is really important. Every message that I have given since the pandemic has started, I always start with, I'm making this decision because the most important thing for me as CEO is the health and welfare of our staff. And then I talk about, this is the decision and this is why, and that we're listening to scientists and to medical professionals in making the decisions. That goes a long way in reducing people's anxieties about what they're hearing, what kinds of decisions people are making. And so the tone that we set, the tone of really signaling to people that we care about them, and that's what's driving our decision making. We might think that people get that, but it's really important to say it.
Great advice. Raymond, do you have any
Yeah,
methodologies?
yeah. So, I remember when I was a trainee some 400 years ago, and the at that time, the culture of medical training was, you do everything you can. You stay awake beyond being exhausted. You come in when you're sick. And when you think about what the implications are as far as the safety of our patients, that's ridiculous. And I think we're beginning to see now leaders say, if you have a fever, you need to not come in. You need to have that evaluated. If you are fatigued, you need to get rest. You need to take care of yourself. And it's great to see that change. But it has to come from the leadership. And fortunately, when I was a cardiology fellow, our section chief very much believed in taking care of yourself, being really connected with your family. And so, if you said, hey, there's this thing that, my daughter is going to be in, first words out of his mouth were, you need to go to that. And so it takes leadership that embrace that. And it has to be done at every level to help support each other. It has to really be a construct where there's that mutual support. Nobody's indispensable, and so we can find people to take care of things, and then come up with ways to cover shifts. And we need to keep that in mind, and we need to support that.
Very good. Leah, you're a professor with sonography students. How are you managing sonography students that may have fear or trepidation of clinical environments?
That has been a challenge for sure. And there's been a really wide range of attitudes towards it. Some students say, I don't care. This is what I signed up for. I'm ready to go. Give me a mask and I'll go in. Others have been a lot more reluctant to do that. So we're trying to help them and give them some coping mechanisms. Here's some ideas of things you can do. If it's a known COVID patient, they are restricted. They're not allowed to actually see those patients at this time. But every once in a while, there's somebody that their test hadn't come back yet and turns out they were exposed. So we do have procedures in place for those students. And thankfully, everyone's been healthy so far. But I think even students are, students that go into healthcare fields are sort of in the mindset of we want to help people and this is what we're here for. So there's part for us that's giving them permission. If you're sick, don't go to work. Even if you just are tired or you feel like you might have a little bit of a fever, it's okay for you to not go in and you will not be punished for that. So giving them the permission, like, hey, you're not going to fail this class because you got exposed to COVID. We're not going to do that to you. Now, if it turns out that it seems like you're taking advantage of things and it's happening over and over, then we're going to need to have a talk. But just giving them that reassurance that things are in place and we have a protocol for them to follow, I think has really helped with the students.
Picking up on that, there's a question that's coming from our audience, which is on the leadership role or the communication role. What happens if there's a colleague, and it appears that's happening in our audience, there's colleagues that are not practicing good COVID prevention. They are out socializing, things of that nature. How do you confront that in your work environment if you know that may be happening and putting you and others at risk? How would you go about dealing with that situation? Whoever wants to go first.
That's a tough one. I think the easy one is at work. If you see people that aren't, wearing masks, that aren't putting on appropriate PPE, who aren't, washing their hands frequently, those are hospital policies, and they're directed at patient health and at the health of all the healthcare workers. And so it's very easy to say in that situation, you need to don your mask. I think it's more challenging if people are doing things outside of here and maybe not being safe. I guess I haven't had to deal with that. Fortunately, most of the people that I'm around, thankfully, are really being pretty level-headed about this. But the point is, it's not just you that you're putting at risk; it's everybody else. And I would love to hear from Arthur and Leah. How do you get that point across? Because that's the thing. You take your own life into your hands. You're responsible for that. But as soon as you have a family, as soon as you're taking care of a patient, that all changes. And so how do you tell someone that and make it in a way that's non-confrontational and really meant to be a positive thing that you're trying to say to that person?
Yeah, I think Raymond's right on. I mean, at the institutional level, it's a lot easier. In fact, our HR department has said this is everyone's responsibility. So if you see someone who is not, wearing a mask or whatever it is, you need to say something. Don't call security and have them come do it for you or anything like that. And you don't have to be mean about it. Just say, hey, you know, you could even just tug on the mask that you're wearing yourself and, you know, make eye contact. And then usually people will put it right on. It is hard when it's outside of work, but I think for that, I might try to just have a conversation with the person and say, because I think some of it, at least from my friends and family and colleagues, they're getting burnt out. They're tired of trying to mitigate COVID. They're tired of wearing masks. They're tired of being physically distant from people, and they just want to go back to normal. So maybe having a conversation with that person that, hey, how are you handling this? You know, I know it's hard. It's hard for me too, and just trying to relate to them a little bit. So I don't know, Arthur, what do you think about?
Yeah, you know, I'm thinking about the psychology of it. I always think it through about these things through the lens of, you know, what does psychological research say? You know, one of the challenges with younger people and some of their behaviors in terms of high risk behaviors is that the way they see the issue is, you know, if I get it, you know, so what? And the framing is around their own safety. And so what we know is that if you can reframe or get people to understand a different frame around the issue, which is, you know, I get it that you know, you don't think you can, this is going to be a problem for you, but if you are carrying it and you get your grandmother or someone else sick, you know, how are you going to feel about that? So I think that the things that you all said were good, but I think but I think the things that you all said were good. And if we're talking to someone where the situation looks like it's the person is really not thinking about that other aspect, sometimes reframing this about, you know, other people might be the thing that might get people to behave a little differently.
Excellent. Pretty much have time for about one more question, and I'm going to take this from the audience. And Arthur, this would be more directed towards you initially, anyway. And you know, I know all of our audience is very familiar with the recent public health data over the last couple of weeks, in which, you know, in the United States we have record numbers of infections uh, based on throughout the pandemic. Record numbers of infections, hospitalizations are increasing, and obviously death rates will increase. Public health officials are saying this is going to last for months more. And what's the psychology behind of getting people prepared for more of a marathon versus a sprint? And how do you reframe the thinking on that to get people prepared for a longer haul, which could go certainly through the fall and winter?
Yeah, you know, I think this is such an important question. You know, if you're going on a vacation, if you're going for a few days, you pack one way. If you're going for several months, you pack very differently. And it's the same with preparing for how we think about how we go through this crisis. In the beginning, I think most of us believed, okay, we're going to have to adjust our lives for a little bit, but we're going to get through it, and then we can go back to normal, you know, whatever normal was going to be after this. But that's just not the case. We have to now have a mindset that is about living with COVID for an indefinite period of time, which is a different mindset than we have to get through this to get to normal, right? So that's you organize your life differently. I'll give you an example from you know my a personal example. You know, the first few months of this, my wife didn't go anywhere. I mean, she was in the house. She was not playing. And, you know, it was like, we're getting through this. You know, now, you know, we take walks. We know how to do that in a way that's going to keep us safe. We do other kinds of things outside of our home. And it's learning how to live with this. And we're actually getting better as a nation at this. You know, you go to the grocery stores now, they have this stuff kind of worked out, and you can it's a both and. You can be safe and do more of the things that make life seem a little bit more normal. So that's the first thing that I would say. You know, having that reframe, I think, is going to be important. And this is, again, a message for leaders. What I started doing early on, actually, probably 3 months into this, I started signaling to my staff that, you know, we cannot work at the pace that we've been working, that we have to back off and to think about this as a long-term marathon, really. One of the things for particularly this audience, again, an audience that is high achieving, that probably has gotten to where they are in life because whenever they have more demands, they do more work, they exert more energy. In this kind of environment, you will burn out if you do that, right? So you can imagine being in a marathon and then running as fast as you can in the middle of the marathon. You're not going to get to the end. And similarly, for going through this, we have to, the things that we have to do are counterintuitive. So when there are more demands, sometimes that means stepping back and saying, how do I not increase my effort, but how do I think about, is this something that I really need to do? Can I do this differently? Are there ways that I can get through this without exerting a lot more energy to get through this? So it's counterintuitive for high performing people, but I think it really is critical that we are mentally prepared for that kind of long haul.
That's great advice, Arthur. Thank you so much. Unfortunately, we are out of time, and we're going to have to kind of wrap things up. But I did give a chance to Raymond and Leah and Arthur if you had some closing comments to your colleagues out there, and if so, about 30 seconds worth.
I'll let them speak.
Yeah, Leah, you want to go first, please?
Sure, Dale. I just want to say thank you for inviting me to be here. I really appreciate the time and your thinking of me for this webinar. And to everyone working out there in the healthcare field, we appreciate all that you do. Those of you that are working on the front lines, those of you who are training students and residents and interns, we really appreciate everything that you're doing. And I just want you to hang in there. And if you have something come up, make sure you communicate it to your leadership. There might be something they can do or something they haven't thought of yet, where they might be able to help you. So thank you.
Thank you, Leah. Raymond?
I also want to thank you for this wonderful experience. I think that a lot of stuff that I've heard today is going to be helpful for the way I approach things. We owe a lot to our healthcare providers, and we need to support them. We need to support each other. We all at different times are leaders, and at other times we are the people that are, doing all the heavy lifting. And in each of those episodes, we need to be mindful of what we're doing. And as I said before, give each other the space and support that we need.
Yeah, Arthur?
I just thank you for inviting me. American Psychological Association is really proud to be in partnership with you, and we want to do everything we can. The people on this call do really important work, and anything that we can do to support folks, we want to do that. Go to our website, apa.org, if you want to get more information about anything that I've said today.
Thank you. And I want to thank Leah, Raymond, and Arthur. Just a fabulous session. I know our audience got a lot out of it. I also want to thank our audience. The chat room was blowing up as you were talking through. It's just some great questions and concepts coming through. So I want to thank everyone for participating and watching today's webinar. Don't forget to join us for our future mental health series webinars, which are noted on the screen. Plus, visit our websites for more information, which does include some of the APA toolkit that Arthur was talking about. Finally, to claim your CME credit, please use the link shown on the screen. Staff will also put the CME survey link in the YouTube chat. I want to thank you for participating. Be well, be safe, and thank you for all you do.
Thank you for participating in this mental health series brought to you by Intellios and its family of certification councils in partnership with the American Psychological Association. You will find additional resources at ardms.org, apca.org, pocus.org, and apa.org. These resources are for informational purposes only and should not be used as a substitute for professional medical advice. We encourage you to reach out to your personal physician or medical provider if you have concerns or questions.